I'm the Healthcare Strategy Officer at NYU McTech. And I know we're a couple of minutes after 2 o'clock. I still see folks signing on, so I think we'll give a couple more minutes before we jump in, just to give folks extra time. And we'll start in 2 to 3 minutes. And thank you for joining today's session. Again, my name is Boris Vilgorin. I'm the Healthcare Strategy Officer at NYU McTech, and today's sessions will be focusing on the NPI, the National Provider Identifier. Before we jump in, just a couple of basic logistics. We'll be taking questions at the end of the presentation. I'm going to ask you to type those questions in the chat box. Should be on your right corner. And I know we're scheduled for an hour. I think we'll try to get this done shorter than an hour today. So let's just dive right into it and go through the presentation and the NPI process. So why NPI? The NPI, as I've mentioned, is a National Provider Identifier. It is a standard that was developed for HIPAA purposes, and it is required for all healthcare providers, especially as it's in financial transactions, billing, and a lot of other information exchanges. And anytime any healthcare provider bills services for their services, exchanges information, NPI is an identifier during those sessions. Oops, jump too fast. Okay, so NPI overview. Excuse me. The healthcare organization and individual providers are required to have an NPI, as I mentioned. It is submitted on claims to Medicaid, Medicare, and definitely managed care organization. And based on the rules of a particular service, you might need to submit both an organizational NPI number and the individual NPI. And at today's session, we'll go through both of those. And in regards to the individuals, the individual, being a social worker, a rehab technician, or anybody who's providing the services who needs an NPI, can only have one NPI number. And the purpose of that is that to make sure that that individual is identified no matter which entity they're billing to with one number. It's almost as if this is their professional Social Security number. On the other hand, the healthcare organizations may choose to have more than one NPI. There is no particular standard or rule. It is based on the healthcare organization to decide if they want to have one or more than one NPI number. However, if the organization does decide to have more than one NPI number, they will have to create separate username and passwords, which we'll also go through in next slides. So what information is required when you're obtaining an organization-level NPI? Of course, the name, the identification number of the organization. You're going to need the name of the authorized users, and also the contact individual, the phone number, and some basic information, of course, mailing address, practice location. There's something that's required, that's taxonomy. We'll go through later of what taxonomy is and how do you obtain a taxonomy code. And of course, as I mentioned, the contact person's name, phone number, and email, which is could be, but doesn't have to be, different than the authorized official for the organization. On the individual level, it's similar information, except the Social Security number is required if one has. There is there's another number if somebody's not eligible for Social Security to put in, but for most times it's the Social Security number, the date of birth, the country of birth, and so forth. The information is on this slide. We're also going to be just, I forgot to mention, we'll be posting these slides and presentations for your reference. Similar for, as an organization, of course, the practice location and taxonomy code. For certain licensing, the individual will need to put their license number and, of course, the state they're licensed in, but it's not required for everybody, only certain individuals. So key information for everybody to have, the NPI website. You can always just Google NPI and it'll bring you to that website. When it comes down to individual providers, it's very important that the individual goes on, completes the application, and obtains their own NPI, and that the organization doesn't do it on their behalf. As I've mentioned, the individual's NPI is their own and will be used if they move from one job to another, or if they're already employed by multiple agencies at all of those agencies. So their password, their login, it is their NPI number. What needs to happen is after the individual obtains the NPI number, they need to share that with an organization for billing purposes. There is a field for other identification number when we go through the application, and we'll jump to that shortly. It is a not required field, but if the organization does have a Medicaid, Medicare, or managed care provider specific numbers in the application, there is an area to fill that out, but it is not a required. So if your organization does not have any of these, that is fine. You can still complete and obtain NPI. And the location that NPI requires is really the primary location. So if your organization have multiple locations, you would need to choose one of those locations to register and obtain NPI. It is recommended and suggested that for individuals, they do not furnish their residential address unless, of course, it happens to be their also business practice location. So let's jump in. So I think, for most of the information that's required is very basic and straightforward. The one that gets sometimes individuals and providers a little confused is something called taxonomy. So taxonomy is a standard code set that basically lets the government and the billing entity understand what services or what category either the organization and or the individual falls into. And it is a code set, again, that was developed for HIPAA purposes and is used across the country. It's the same code set at this time. And it is a required code to be selected for you to obtain the NPI number. So the taxonomy and the list of taxonomy codes could be obtained at the website presented here. It's broken down into two sections. The taxonomy codes is broken down into the organizational level and individual provider level. So whenever selecting a code set, it's important to fall into the right category depending on which one you're selecting, and then of course choose the code that's more appropriate for either your organization or individual. So, for example, if the individual is a psychologist, there's a taxonomy code for psychology, a social worker, and so forth. So one of the codes that might be and probably commonly used by community behavioral health organizations is the 251S00000X code. And so I just presented one of the codes. It's an extensive list that you might consider to use as you go through the code sets and a definition of this particular code. When you get into the website and you look for the code sets, all of them do come with these definitions. So I strongly recommend before selecting it, making sure that it's appropriate for your organization. And again, that if it's on an individual level, that it's appropriate for the individual practitioner. as I mentioned before, for the individual practitioners, for certain individual practitioners that are listed below here, that is registered nurse, chiropractor, clinical nurse specialist, and so forth, one additional information is required, and that would be the license number and the state the individual is licensed in. Outside of this list, the license number and or the state is not a required field to obtain an NPI number. So with that, this gives a brief overview of what is required for NPI and where to obtain. What I'm going to now show you is there's a paper form or PDF form of the application. However, what I would strongly recommend that when you apply for an NPI that you actually do this online and complete this information online. Usually, and for most part, the NPI sometimes could be, obtained within 24 to 48 hours after the online information is obtained. So, of course, if you choose to complete it on paper, CMS does give you this option. You would have to print it and sign it. But the paper form and the electronic version is almost identical. It's also good to sometimes use the paper form as a kind of a test run to compile all the information, make sure everything is completed. If you need to share it internally to make sure everybody's on board with this, it's another way of doing it. And then when you have all the information, using it as a guide to complete the online version of it. This application will take you through really, both individual and both organization level. It will give you all the information we really talked about, the mailing address, the business address. And the application itself also, when you get online, there's a lot of, helpful hints and description that goes step by step in regards to what needs to be filled out or what information in particular is being asked for. And, and of course, just like a lot of other government documents, there's a lot of legalese about where it came from and the purpose. And as I mentioned before, at the end of it, there's instructions that take you step by step in case you need additional information on what happens. So with that quick and basic overview, for most part, just to mention, it takes probably, after you have all the information, which is not really a lot, is maybe 10 to 20 minutes to complete the application online. And as I said before, in a lot of instances, within 24 to 48 hours to obtain that. So with that being said, I will stop now and ask if there's any questions. Again, I think the questions, if you have any, please write them down in the chat area and send them to either the host or the presenter, and I'll be more than happy to answer them. There is one question that I have. The slides will be available, and both on the MCTEC, it'll be available on the MCTEC website. The application, I have another question here that says, how many pages is the application? The pages where you have to actually fill out, I believe it's 3 to 4 pages. But again, depending if you're filling out for individual and or organizations, some things are not applicable. So for example, what we have on the screen, if you look down under entity type, it specifically says for the individual which sections to fill out and for organizations which sections to fill out. Okay, so there's another question. We have an NPI for our PROS program. Do we need a discrete number for HCBS services? At this time, it really is about organizations. Some do choose to create an NPI number for service type or program types. So for example, some organizations might create an NPI for their clinics and then an NPI for their PROS, an NPI for their HCBS services. It's really a preference more on the provider, and sometimes if they are a legacy Medicaid and or managed care provider, they might want to link that to those services. Okay, let's move on to the next question here. If, again, a question, if there's already an NPI number, they usually do not need to create a new NPI number. Trying to follow through. How often do you recommend we update our NPI information? For most part, unless the main location is closed and you need to change your primary location, clearly if you need to change the contact or authorized individual, but otherwise NPI, if there's no changes in the primary location, contact individual, and so forth, does not need to be updated. I want to make sure I'm capturing all the questions here. We have a per diem employee. Do they have to come under the organization? So again, it really will depend on the services and the requirement of the billing. If the billing or particular service requires an individual's NPI, it's blind to how the individual is reimbursed internally by the agency, their per diem, fee for service, salaried, and so forth. It's more about the individual and is that information required. So if it is required for billing purposes, then yes, the individual's NPI would need to be included. Is there an advantage to a discrete program NPI number? You know, for some folks and some finance departments, sometimes like to have a discrete NPI number, and they internally use it as a way to track revenues and expenses to match their financial codes. And depending on how the financial codes are set up, they sometimes might match it with NPI. However, there's a danger where if you have too many financial codes, you might have a tremendous amount of NPI numbers. But again, it's more for the individual organizations to make a decision. Okay. All right, so I'm being asked to put the presentation up so the website could be seen. I'm going to do that right now. So this is the NPI website. So there's a question from the MMIS, or basically the Medicaid system. Is an NPI required to apply for MMIS? I am not familiar too much with the requirement on an MMIS side and what is required or not. I do know for any billing purposes, irrelevant of the Medicaid ID number or not, an NPI is required. Let me just see if I can. Right. So just a mention and a plug. There's a training, there's a pre-training, I think, webinar being done on Friday, May 1st and May 11th. That will give a broader overview, not just, of course, about NPI, but infrastructure and the whole scope of kind of becoming a Medicaid provider and moving into the managed care environment. So I just want to make sure that folks are aware of it and have had the opportunity to register. Okay, let's see if I missed anything. So does this apply for partial and chemical dependency? Again, this would apply for any program and or service that the individual organization would need to bill either Medicaid, Medicare, and managed care company. So as things move into the HARP environment and services become carved in, NPI is a required number for billing purposes. How can you register for May 1st training? I believe it should be on the MICTAC website. The rules about what agency employed individuals must have a number as opposed to just using an organization number are outlined at the NPI website. The rules, if I understand the question correctly, the rules of individual versus organization is really driven by a particular service and billing codes and requirements. The NPI website really just is a way to obtain the NPI number for individual and organization. It will not provide information on if one is needed, particularly at an individual level. So again, there's more questions about the training. It should be on the MICTAC website. Okay, just going through some of the questions. Okay, and if you don't see the information for the upcoming training, please email to mictacmctac.info@nyu.edu, and you'll be able to obtain that information. Again, that's mictac.info@nyu.edu. All right. I think that covers the questions I've got. Give it another minute. Go quickly through, make sure that I didn't miss any. That kind of covers it. Is an NPI required for an existing IRA? Again, NPI is required for any organization, program, and services that you would be doing billing for to Medicaid, Medicare, and or managed care. All right. So with that, it doesn't look like there's any more questions at this time, but if you do have any questions, you can always forward them to mictac.info@nyu.edu, and we'll be more than happy to answer those. So thank you for your time. Hopefully this was helpful, and if you have further questions, please send us an email at the website mentioned. Take care.